Okay, I think our numbers are slowing down. Good morning, everyone. My name is Heidi Hedberg. I'm the Commissioner for the Department of Health, and thank you for joining us on our Impact series. Next slide. So rural health transformation. This has been a journey for all of us. We have 6 initiatives, and each initiative is going to have an impact series. And so today you have joined us, and we're going to talk about workforce. We're going to do a quick overview of the RHTP impact series, what it is not, an overview of the program, and then start to dive in about transformation. What does transformation really look like? And then there'll be a quick wrap up. Next slide. Joining us today, we have Dr. Ann Zink. She is an emergency medicine physician. She is also a professor with the Yale School of Public Health, and she has her own consulting work. In addition, we have Dr. Lisa Rabinowitz. She is also a practicing emergency medicine physician and does her own consulting work. We're very excited that they are our facilitators for our Impact series, and I will kick it over to them.
Amazing. Thanks, Commissioner Hedberg and the entire team at Department of Health for really creating this space where we can start to explore strengthening our workforce. We're really excited to come together and find ways with all of you to innovate and partner as we really envision real impacts to the health systems in Alaska. And thanks to all of you for joining again today. For many of you, there will be some repeat slides as we kind of go through the initial information, but we're really excited to brainstorm together today, find ways to broaden our impact with these projects. Collaboration is key, so please introduce yourself in the chat, share details about yourself, your organization, especially if you're an Alaska-based organization, put that in there. And again, don't be shy. Put in your email, your contact information so we can see synergy both inside and outside of the webinars. We encourage people to come together and really create this community of practice as we brainstorm together. And next slide. So there are a lot of amazing resources that the Department of Health has worked hard to create. It's also been a very transparent process. So we want to encourage you to visit the website, which has a ton of great information. There's also office hours, really for technical assistance around the application itself. And then stay tuned for dates for the in-person regional planning meetings, and those will be out shortly. And that's really so we can help gather community input on all of the unique needs that each of these health innovations can bring to that region. And today we start the impact session for strengthening workforce. This is designed to explore the 6 initiatives or focus areas. We had our first one yesterday on healthy communities and excited to talk about strengthening workforce today. And next slide. RHTP impact sessions are going to be organized again around these 6 focused areas. We really want to prioritize participant recommendations while also staying with the state priorities. So that's one of the things we'll help navigate today. It's important to note that your organization or project may bridge across multiple of these initiatives, so encouraging you to attend any that kind of align with your vision for your project. And next slide. Couple things as we move through this, and I wanted to remind people that these series really are not for endorsing or picking projects. And so we really want to focus on kind of the broader blue sky thinking that Commissioner Hedberg recommended earlier. So it's great. There's a million amazing projects out there, and we want to hear from all of you, but really kind of using this time to help each other innovate and broaden our reach is going to be really important. And just a reminder that both Dr. Zink and I have no stake or role in selecting the project, so really just focusing on the big picture is going to be important. So these series are all about connecting and really getting stakeholders together across the state. This includes tech experts and vendors that can help add expertise to your project, but we really want to focus on the Alaska first, kind of what's already happening here, and then we can kind of build in where that expertise needs to happen. Fostering collaboration, learning and information exchange is going to be really important. Building a shared vision for transformation and talking about successful projects both in Alaska and outside of Alaska. And then sparking innovative thinking and encouraging us to think and reimagine how we want this to look for our future generations. I think it's important to also create space for projects that don't go as planned or that we have to recalibrate, rethink about. And the Department of Health and also the Rural Transformation Program has built this in over the 5 years so we can reimagine, change, and learn from things that don't work as well as we thought they might initially. And then identifying and promoting these partnerships that we keep talking about. That's really what this space is designed to create. And next slide. I'm going to kick it over to Dr. Zink to explain a little bit more about the broader program.
Yeah, thanks so much for Dr. Rubinowitz. And it's fun to see everyone putting stuff in the chat bot. I know that this chat can go fast and furious and can be hard to capture. So the team on the back end is working on capturing it and being able to share it as well. For those who attended last week or yesterday's, I guess it was only yesterday, not a whole week ago, compared to today, I appreciate people putting in where they're at, like if they're Alaska based or not, and how to connect. So, calling out like Barb Doty working with the WWAMI program, and here's her information so that those non-Alaska people can see where there might be synergy as a whole. So, Jacqueline Summers, does a ton of work in helping with workforce and is here and listening and excited to see so many participate. So I just wanted to highlight that chat bot and know that it's going fast. Big picture, lots happening in rural health transformation, and this is not the only thing that's happening in healthcare, as we all well know. But this was passed through Congress as a one-time 5-year, $50 billion incentive to help catalyze rural health transformation. The Department of Health chose these series as impact series because that's what they're hoping to get out of this, to have real impact with these dollars to transform Alaska's healthcare to serve every Alaskan the best way that we possibly can. And so it's exciting to see how they have been, wanting your input and inclusiveness. And that's why we're all here today to vision what this is going to look like together, because it's going to take all of us to be able to make this change together. So some of your projects may fit really well within the rural health transformation. Some of them may not. But Alaska submitted their application for funding in November of 2025 and was awarded one of the highest at $272 million for the first year. So that's what needs to be allocated between January and October of this year. And if you go on to the next slide, you'll see that this is an iterative process in the way that CMS has set this up. A little bit different than many other federal grants where there's this one grant and you've got your 5-year plan and you put it out. They're looking for us to succeed. They're looking for us to fail. But most importantly, they're looking for us to iterate to be impactful by the end of 5 years. So this process will continue to go. So if you don't have your whole plan for 5 years, that's okay. This wasn't set up for a 5-year plan. And so maybe your first year is really connecting with the people on this call and others who are thinking deeply about workforce. And by year 5, there's a sustainable model that's there with a progress along the way. So just really want to highlight kind of these benchmarks along the way that will continue to work with you all to support how we think about workforce within this big and beautiful state. Moving on to the next slide. There we go. I want to just, one of the things I loved about when I worked at the state and working in the Department of Health was the mission. It was so helpful to always go back to the health, well-being, and self-sufficiency of every Alaskan. It's easy to align policies if you know what your vision is and to stay aligned with that. So we put this slide repetitively within each of these ones to highlight what is the vision of the Rural Health Transformation Project for Alaska. And that's really to ensure Alaskans get affordable care to stay healthy, making primary and preventative care readily available and close to home, making it easier to get mental health, specialty, emergency, and long-term service care by reducing barriers so providers and the workforce, like we're talking about, can focus on patients. And as a practicing physician, amen to that. Really excited to find ways to really be able to make these systems work better for patients and providers so that we can get back to the relationship and the care that is needed. And to do that, we're going to have to grow our workforce. And that's what today's topic is. And there will be ways to use technology and innovation to be able to do that as well. So there is a separate series on that. If you go to the next slide, this is how they have broken that vision into three different buckets. There are six different kind of sub buckets within it, but I personally think of it really as three buckets: healthy beginnings, healthcare access, and healthy communities. And that this paying for value, this strengthening workforce, and this sparking technology and innovation are the keys to making any of those three happen. We know that none of this can happen without the workforce. And so we will be having a series of sessions. Today's is really on strengthening the workforce. What are you all doing to strengthen the workforce? What do we need to strengthen the workforce? And how can we use these dollars most appropriately to be able to strengthen the workforce within the state as a whole? So with that, I will turn it back over for slide 13.
Perfect. So we're going to change directions a bit right now, and let's have some fun as we find ways to kind of inspire, help each other reach towards this innovation that we keep talking about. And really, as we talk about our impact on strengthening workforce, we need to figure out what we would imagine as our rural health workforce. How does that play with urban, suburban, and rural? And a lot of those topics came up yesterday. So this is where we have the most fun. So next slide. Why do we want to focus on strengthening workforce? Really because this initiative aims to build a resilient rural health workforce. It creates sustainability across all the initiatives if we have a strong workforce in place. And really the Department of Health worked hard in their application to create a framework for this funding. And these approaches on this slide are really what we need to follow as we're working towards building our systems that can be supported by this funding. So developing workforce pipelines and recruitment pathways, targeting signing and retention bonuses tied to 5-year service commitments in remote communities, enhancing retention and provider support through structured mentoring, continued education opportunities, incentive programs linked to long-term service, alongside wraparound supports, time-limited housing assistance, and childcare partnerships, which we keep seeing as a common theme that comes up. So these are things that as we talk about systems and we talk about innovating, we need to keep coming back to these approaches that have been set out from the Department of Health. And we can move to the next slide. So there's a lot of things that are working well in Alaska right now, and a lot of work that's already being done on workforce strengthening. The WWAMI Medical School program through UAA has created a program that now allows the majority of students to complete their education in Alaska. Really, this strengthens that connection and dedication to rural health in Alaska. The tribal health system has also pioneered the community health aid program that trains local residents to act as frontline providers. We still have a long ways to go. All of our communities in Alaska have at least one health professional shortage area designation and experience high staff turnover, as all of you experience in your day-to-day organizations. So what other key strengths or challenges should we consider as we envision a transformation for our workforce? And that's really what we want to dive in today. So next slide.
So when we're thinking about what does workforce look like and what ways we can support it, we want you to think broadly about this. So this might be apprenticeships. This might be grow your own high school certifications. This might be funding and expanding training and workforce development. I've had a lot of physicians come up to me and say, we need this, but we just don't have the workforce to do it. Thinking broadly about how we can upscale and upskill those providers who are currently in state to learn additional skills or resources to be able to address a need that's there. Support development, expansion of residency programs. So Dr. Rabinowitz mentioned the 12, and have Dr. Jay Butler on here, who's at the university working at the Department of Health or working at the College of Health. I'm still thinking of you as part of the state, Dr. Butler, but in the College of Health, and thinking about the residency programs, or again, Barb Doty, who's on this call, thinking about how we get clinical rotations. What does that look like? offering structured incentives for certain providers to commit to staying up here. We know that coming up and working in a rural area is the number one predictor of staying within this area. But we train in urban areas. We don't tend to train in rural areas. So how do we train locally, keep locally, and expose to the amazingness of working in the state? I thought I would be up here for 2 years, and that was 18 years ago. Sometimes you get you in a little bit, and you stick and you stay, and it's a great resource. Expanding the scope of practice. How can we take a set of skills and be able to expand that to meet the needs of today? Launching housing placement and resource for healthcare providers and students who are moving around the state or needing to work in different areas. And again, childcare support services and TA support to strengthening workforce projects. So these are just some ideas. Some of you have a lot more ideas out there, but we just wanted to kind of ground in kind of what this topic on workforce is really focusing on as a whole. If you go to the next slide, this is an opportunity for you all to be a little bit more engaged. So there's a lot happening in these first ones. It's a big overview, but when we have follow-up sessions, we're going to do these about monthly. Our goal is to focus in on themes much more specifically. And so we would love for you to rank the order of priority for strengthening workforce. So we're going to go ahead and launch a poll, and you'll see on here these different categories: healthcare workforce pipeline, community health work certification. We want you to rank if you think this is not a priority at all, somewhat a priority, or very high priority. And by doing that, you can help us to prioritize what we're going to talk about, what we're going to share, and how we're going to build communities of practice around different topics. And then also, it's one of the challenges, like we can't do all things. So we'd love to see what Alaskans are prioritizing in terms of workforce as well. So I'd love for you to take a minute and take a look at these and go ahead and put in there. If you're having a hard time with the poll, which should have popped up on your screen, you can always write in the chat box and we'll try to grab that as well. But the poll is a nice way for us to gather your information in a quick and easy way. I'll give you a few minutes to go ahead and fill that out so you can read all the different great buckets out there. And the team is watching from the back end to see when the numbers start to slow down, and we'll release the poll whenever you guys are starting to slow down in your clicking. Lisa, to your comment, you can put the poll answers there, but you should have seen a pop-up screen on your Zoom window, but we know that doesn't always work with anyone or with everyone. And to the comment about can we get copies of the PowerPoint slides? Yes, we will have those on the website. Sorry, Lisa, not on your screen. Feel free to put it in there and we can work with you.
And real quick for everyone, so this is recorded. It will be posted on our website with a Cliff Note version, so you can get the highlights from this webinar.
Thank you, Commissioner. Okay, how are we doing on that poll? Okay, here it comes. Drum roll, please. Anticipation. Ah, there we go. Okay. So I think you should be able to see it now. We have a clear winner with rural provider retention. There was a question in the chat box about incentives, and I guess I would see a lot of this kind of in the incentive program, be it incentive in, job guarantee or financial. But we can explore that topic together more. Cross training and team base comes up pretty high here. Healthcare workforce pipeline comes up probably just as close as rural health retention and behavioral health workforce. So it seems like we got three big winners here with the healthcare workforce pipeline, rural provider retention, behavioral health workforce growth. But interest in many of these different areas, it's really helpful for us to see what you guys are prioritizing, because that helps us to prioritize you and be able to put out for support with the support of us and the Manat team and the Department of Health. We'll also be looking for examples across other states and regions where they're really leaning into this. So we can look at what's doing amazingly well in Alaska, what needs to, improve in Alaska, but how we can learn from others across this country to be able to take new and fun ideas overall. So excited to be able to build that in. Go ahead and move on to the next slide, please. So I'm going to go ahead and turn this one over I think I'm turning this one over to Dr. Rabinowitz. Nope, I'm not. Okay, I'm keeping on with this one. Dr. Rabinowitz keeps me on my toes by going through the different order. So let's start off. Last time, those of us who attended yesterday's, we had you guys talk about your blue sky. What we decided to do this time is to talk a little bit about a vignette to kind of ground us in a patient story. Again, I always say, do what's right for patients and the rest is noise. So we're going to kind of talk about this story in this vignette and then have you guys help us think about like how we can solve problems to that. So the Tundra River Community Clinic in western rural Alaska keeps consistent care teams has been an ongoing challenge. Providers rotate on and off, have short-term assignments. Patients regularly have to tell their stories to unfamiliar clinicians. A lot of this is about trust. You're sharing some of your most personal information. Clinics' aging buildings limit privacy and collaboration, making team-based care difficult. And when patients need subspecialty care, they have to oftentimes travel incredibly long ways. As many of you know, Alaskans on average travel 150 miles one way to get access to care. And oftentimes that means it's fragmented and the telehealth system can be fragmented as well. Additionally, health records don't always arrive in time. Those two white pills that you think you take, it's hard to know to have all your clinicians know what that is. Incomplete information leading to delays and missed opportunities for prevention. So, not that this happens in every community clinic within our state, but I think we've all experienced parts of this across all aspects of healthcare within our state and country. So, moving on to the next slide.
So
Dr.
we're
Rubin.
gonna, yeah. So this is where we really would like people to raise their hand, and then we'll call on you to kind of unmute and share. And what we want to focus on is, again, that blue sky thinking. You all have amazing projects that you're already thinking about, but how do we transform a system of workforce? So what would a transformed system for Tundra River community in this vignette look like in Alaska? What would be different for the providers at the clinic, the families they serve in the broader community? And I'm going to put Jacqueline Garcia on the spot to kind of talk a little bit about apprenticeships and occupations to kind of get us started off. And then we can kind of dovetail into that and how we would build a system augmenting the apprenticeships. Jacqueline, are you able to unmute? Okay, let's get some more in the chat box. I'm going to ask Dr. Butler to share a little bit about what the Department of Health College of Health. I'm doing the same thing that Dr. Zink did at UAA because they've had a lot of traction in building programs and broadening programs.
I think people are unable to unmute. And so I think if
Yep.
you raised your hand, then our team can find you and then they can unmute you. So I think that is the challenge on that space right now.
Okay. Well, let's
There's
keep using our chat box as we raise our
there's
hands.
3 hands that are raised.
Okay,
You can see those
so
people.
Dr. Butler, I am clicking on you. Maybe that allows you to unmute and share a little bit about what you've been working on. Looks like we're still having some technical difficulties with the unmute portion.
There you go. I can hear you there.
I'm released in by audio. Can you hear me?
I can hear you.
Oh, excellent. Okay. So let me start actually at probably a little higher level than Tundra River Community Clinic and first sort of maybe put out something in terms of what we kind of have now that seems to be working, which is the older model of healthcare focused on medical doctors and community health aides. With the expansion of the WWAMI program to 30 seats, I think in terms of medical school, we have a good, robust program here in Alaska. I know going back 10, 15 years, there was a lot of focus in the tribal health system to upgrade the training for community health aides to be able to make it efficient and to increase throughput. I will defer to anyone who would like to talk about where we stand in terms of the pipeline of community health aides out into the rural areas. So starting with that positive affirmation, let me move on then to where our opportunities are. And I'm going to bring kind of the university perspective, the College of Health perspective to this, focusing on some of the areas where we're looking at being able to improve the pipeline. I think top of the list is nursing, and that's really the whole spectrum of nursing from CNA all the way through to a doctorate and advanced practice RNs. I think there's a lot of opportunities in allied health. We certainly hear that from the hospitals in terms of the types of workers that they need. We actually was just in a meeting a little earlier this morning to look at what are some of the holes right now? What are some of the programs that we don't even offer at all? That the only way to get providers in is from out of state. And then last, behavioral health, which I think really showed up in the survey you did as well. Overall, ultimate goal is to get the right provider into the right place for ideally a lifetime of service, that the providers are part of the community and are able to operate at the top of their license. And I just to personalize that a little bit, I think I sort of fit the same mold as Dr. Zink. I came up here for, quote, a 2-year assignment almost 30 years ago, and family is here now. This is home. So that happens. And I think being able to provide the opportunities for people to who are from Alaska to be able to train here increases the chances that they'll stay, but also we can attract people from outside who come in and just fall in love with Alaska. The one other thing that I'll mention that thinking about this idea of people being able to train here that I didn't mention already is graduate medical education. While we're able to crank out students that with an MD, their training opportunities right now are much more limited to the 8 family medicine positions at Providence. There's 2 rural track internal medicine residency slots through UW for the 2nd and 3rd years in Soldotna. But beyond that, we don't really have a lot. And I mean, people, if they know of another position or two, there's more often rotations here. And those are important as well, because I was just talking with a retinal specialist the other day that he came up and did a rotation in Alaska, and both he and his wife fell in love with the place. And he's now a retinal specialist at ANMC. So having those opportunities for people to be able to apply their trade in Alaska sometimes is the way we can attract people who will be lifelong providers here in state.
Yes.
So with that, I'll turn it back to you, Lisa, and Ann, and Heidi, whoever would like to go next.
No,
Or
that's
happy to
perfect.
take questions.
Yes, no, I think that's perfect, Dr. Butler, and it's infectious to hear your passion for this. And so we're so happy that you're working hard on this. I want to invite Jacqueline Garcia again. I think she's able to unmute now to kind of talk about what she's working on apprenticeships, and we can start building this system together as we look at all these aspects.
Hi, Lisa. Can you hear me?
Yes.
Yes. Thank you for this, letting me speak. With registered apprenticeship, the greatest part of registered apprenticeship is that the apprentice is earning and learning at the same time. And in most instances, most people cannot afford to go to a technical college without or even attend college, because at the end of the day, there's funding. You know, they all have to pay for their schooling. And with registered apprenticeship, at least these apprentices are now working full time, and they are attending school online or in person, depending on the college, to attain, you know, the customized learning to be in that occupation. And so if we look at Alaska Primary Care Association, they have many registered apprenticeship programs, and all these apprentices eventually graduate as pharmacy techs, medical techs, medical assistants, things like that. We also have a HD Medical Services, another sponsor that's 100% graduation rate for EMS 1, 2, 3, and paramedics. Okay, so these are all apprentices that in the end are earning and learning. We now have the Alaska Board of Nursing that offered support for the LPN Registered Apprenticeship Program. So we have over 6,000 registered apprenticeship nurses nationwide. This is something that Alaska should engage in. So I mean, more specifically for rural Alaska, because there's a group of people that do not want to come into Anchorage to go to school. They prefer to stay in their areas and learn. And this is how we can offer those people and grow them in their areas.
No, absolutely. And thank you for sharing that, Jacqueline. I think it's exciting to see all these apprenticeships getting off the ground and really supporting that, especially into our rural health system. I think there's a lot of aspects that we're seeing in the chat, and Dr. Zink is collecting these as well. But basically, we need to support people as they return to their rural communities. Is there housing? Is there childcare? And then this incentive thing has come up a couple times. And really what the Department of Health has prioritized is not short-term incentives because of this turnover issue that we're seeing repeatedly, where these communities have a healthcare worker and then the next year they have no one, and it's really disruptive to the care. So really building in like long-term incentives and prioritizing becoming part of the community that you're going to serve. And so that's, as we look at incentives, that's something that we want to make sure we're tackling. And Dr. Zink, are there some other themes that you're seeing that you would like to highlight?
Yeah, I want to highlight just we talked about upskilling. There's a great comment about paramedicine and the way that paramedics can be used. We had someone on yesterday's webinar really talking about EMS and the ways to partner, thinking about healthy communities. And so when I think about EMS and paramedicine, I think about workforce, I think about communities, I think about healthy beginnings. It's all of these different aspects. So just wanted to highlight that. There was a comment from Suzanne about the pediatric track. So, we might not be doing full residencies here, but just like they're doing and bringing residents up for a few months to get that experience and really good data on showing kind of retention within the state as a whole. I would also like to just call out for those who may not know Alaska as well. There is a lot of amazing Department of Health staff on this webinar, and they've put their information. I see specifically comments, with like oral health out there. They know Alaska super well, and they know the partners and the players. And so if your program or interest is related to something that you see from one of the Department of Health staff in the chat box, their information's there. And that can also be a good lead in connection to make sure that we have the impact as is useful as possible. But Dr. Rabinowitz, back to you.
Yeah, that's great. I'm going to call on a few more people. I'd like to invite Alan Swenson to share some thoughts with the group.
Hey, thanks. My name's Alan Swenson. I'm a proud local WWAMI grad and really love working here and really excited about the programs. And, I've talked to a lot of providers. I work at a couple of remote clinics and things like that as well. And one of the biggest things that comes up when we talk about workforce development is having a broader reach of a cohesive integrated provider development program that we can kind of grow our workforce and focus on all the avenues of development. And that's, I think, the most exciting thing about this, because we need to grow our own. We have the WWAMI program and a lot of other GME programs through UAA and the University of Alaska system, which are amazing, but we need to kind of help bolster those up, support them more. We also need to figure out good ways, like you were talking about, to retain the talent that we bring from outside, and not only bring people here, but help them stay here and help them be supported. And then we need to maintain the current workforce. I mean, burnout is such a problem throughout the medical system. It is only compounded in rural areas like we have, and that really contributes to the massive degree of turnover. And so I think if we can kind of help address those things in a much more integrated way, it's going to be really beneficial. And one last comment I have is I think we do often, we get people up here. People come up through the urology residency program, the pediatrics residency program, through other systems, and we really rely on the beauty of the state and the amazing population that we have here to woo them. But I think we have kind of dropped the ball in creating an environment that's supportive of physicians and other providers, health aides, and things like that, so that they can look at making more of a career out of it. And so I think we need to kind of focus not only on incentives to get people here and some of these long-term incentives, but then create a workforce program for them that provides opportunities continually, and not only those opportunities that are there in the here and now, but people really want room for growth. And that's another thing that we've heard, is that people they want to provide help, they want to do things, but they don't want to stagnate in their careers. So we need to really think about how we can create this kind of an cradle to the grave almost career development pathway for people, so we can kind of plant the seed early in the education, help bring people up through the workforce, through the GME programs that we have, keep the people that we have in state, bring the new ones here, and then just foster them into leadership roles on the back end, so that we can help maintain this structure. And I'm just really, really excited about the RHTP program, and I think what we can kind of do for that. So
Yeah, no, and I appreciate all of those thoughts. And just a reminder as we talk about this, like really, we still need to support the rural housing, rural childcare, so families can move to rural Alaska and provide care. So we can't forget that as some of the foundations we need to build in. Eliza Eller in the chat has made some great comments and talking about being a peer support trainer and what it looks like for the community health workers. Eliza, are you able to unmute and share a few of your thoughts? And you might have to raise your hand first.
There you go.
There we go. Can you hear me?
Yes.
Hi. Yeah, I've been really thinking about this workforce development thing, and I've been thinking, well, we need to do both. We need to bring in, make it more attractive for folks to move to Alaska who are, those docs and nurses and high-end medical staff. But we also really need to grow this workforce of, people who are trained relatively, who have life experience, who want to support, who want to help, but like somebody was saying earlier, they need to make a living. They can't just volunteer. So having really strong community health workers and peer support specialists who specialize in behavioral health on the ground as teams who are based within clinics, within other community organizations, tribes, whoever is the local place or places that make sense for them to live, and have teams that can work together, not just one peer support, not just one community health worker, but, use the local population, hire them and train them up well and give them some really good support, coaching, ongoing support, and really good supervision, and they can do so much for the population, I feel.
Absolutely. Thank you, Eliza. I think those are great insights into, building that support around these systems and really feeling like these clinicians are supported by other systems around the state.
Exactly.
Yeah.
Just to say, I think that they need to have a really, both levels of medical staff need to support each other. There needs to be a strong layer, different layers to really support the people well.
I like that. And on that theme, Dr. Zink, talk about layers a little bit.
Yeah, no, I so appreciate many of the comments in the chat. I want to just go back to what Alan had said. I'm going to not choose cradle to grave because that seems like a long time in your career, but maybe the full lifespan of your career, working at from early apprenticeship. There's been a lot of comments about retention, about sustainability. Eliza had just talked about the role of community health workers and thinking about what mechanisms do we have to pay for, to not pay for. I'll call out, I see some Enrique Guardos is on here, who I worked with for years on helping to do complex care navigation and has a lot of experience working across other states, thinking about how do you, utilize community health workers to be able to support peer navigation, just like Eliza that you were mentioning specifically in there. I hear a lot about kind of having shared goals and what does that align and thinking about the broad breadth of the state. I did want to take a moment. There was a comment early on was like, redo that clinic ASAP. And there's some comments about incentives. And, we are working within kind of the boundaries of what the rural health transformation will or will not pay for. And so I'm going to turn that over to Commissioner Hedberg for a minute to just comment a little bit on kind of some of those boundaries that CMS has put forward for us so that we kind of know the walls of the rural health transformation. Again, this isn't a TA session, but we want to make sure that we're kind of sticking to what we can and can't do with these funds, even though there are huge needs outside of these funds. Commissioner?
Yeah, thank you so much, Dr. Zink. And it's so great to see the active chat that's happening that's parallel to this conversation. So think of the Rural Health Transformation Fund as one resource among many to really support the enhancement around workforce. So Jacqueline, I really love that you chimed in and talked about apprenticeships, right? That's a partnership with the Department of Labor, with the feds, and with the state. It's about bringing those two together. RHTP, CMS has said if you are going to be paying for degrees or certifications, there's a commitment that needs to be made, and it's very nuanced. And so I would reference you to go to our website, look at the FAQs, and look at what some of those requirements are when we're using RHTP funding to pay for that incentive for that provider to come work in that community. It's a consideration to think of. I'd also say, there's been a lot of conversations like we need the workforce. There's a lot of conversations around the training, but there's a great comment about supporting somebody in community. We have families, right? And we need to, for those that are growing family, making sure that they have access to childcare and a place to live. I know traveling out to communities, sometimes we sleep on the floors in gyms because there's no housing. And that's a real thing in Alaska. You can't use this funding for construction, new construction. You can for renovations. That's one of those limitations on the RHTP. So I really want to encourage all of you, think of RHTP funding as one resource. How do you weave that together, braid that funding together for the totality of the change that you want to make in your community? Back to you, Dr. Zink.
Great, sounds good. And to the team, can we go ahead and put people who aren't speaking back on mute? That would be great. I think we've got a typer getting some work done at the same moment. So a couple other little comments. Thank you so much for Commissioner for highlighting that. I just also want to raise up, there were some comments about licensing and the importance of licensing. Rules are made by humans and we get to make the rules. So let's think about like what licensing needs to happen, what doesn't, and how do we get people to that space. There's also some really great comments about the HIE and workforce. We will have a Spark technology one as well, where there will be more focus on that. And I think that goes to Zoya's comments where there's a lot of comments about like, how do you make it so that your practice is really fruitful and meaningful and that you're able to grow and have that continuing medical education and a team of providers as a whole. So we see this little work group as kind of how to grow that workforce, but we know that that is not in isolation and that technology, how the whole system is working together, how it's paid for are all important components as well. And with that, back to you, Dr. Rabinowitz.
Perfect. So if we can advance the slide, we're going to go back to our Tundra River Community Clinic. So we've done transformation. It's stable, high-performing center of care now. We've got dedicated long-term workforce. We've modernized. We're using some tech innovations. And next slide. So now that we're here, where would the changes need to be made across Alaska to achieve this vision? We kind of started this conversation, but let's think broader now as we look across the whole state. What initiatives or projects would help facilitate this? Start putting ideas in the chat. What partnerships would need to exist? So again, focus back on partnerships. How can we connect the volunteers with the EMS service? How can we connect SUD therapy with the behavioral health mobile clinics? And I'm going to ask Shane Scott to go ahead and come off mute and share his thoughts. Hey
Hello,
there.
this is Shane Scott with Healthfront Ventures. Thanks for having us. I got one of my esteemed colleagues, TJ Phipps, on this webinar as well. We're frequent flyers to the webinar programs. So I just wanted to share that we have a different perspective on the rural health front the rural healthcare transformation program with Healthfront Ventures. Is that we take the data approach, and we feel like in many cases around any kind of transformation, it's important to have when one of you were speaking about layers, and we provide a layer of data intelligence and workforce intelligence. And we're really trying to answer two questions. Uh, who is delivering care in the state of Alaska, and what kind of care is being delivered specifically? And so if you can answer those questions from a data perspective, then it allows us to aggregate that data and then segment that data and find the places where there are gaps in access. Where yesterday we're talking about asthma, where asthma is prevalent in certain counties or boroughs or census tracts that you have in the state. And it's just so powerful to use the information that is in front of you. And it just turns out that our organization is the U.S. largest database
Yeah.
in data.
Yeah, absolutely. And thanks
Yeah.
for sharing, Shane. I think, as we look through the chat, there's a lot of health information innovation, data information that is going to be key as we do innovate. I think somebody mentioned layers, and I think that data is all part of the layers as we kind of connect on what information we need to make true transformation. Barb Doty, you have chimed in a few areas, and I would love to hear your thoughts on this. So, Dr. Doty, if you don't mind raising your hand and coming off mute, that would be very great.
Thanks, Lisa. Yeah, just a couple things. One is, the Alaska Cash is a wonderful resource for finding continuing education to support your clinicians of all levels. And I think that more widespread knowledge of that would be really helpful. And then the other thing is I have struggled all across professions in healthcare looking for where's the best job posting? Where's the true information about what those jobs are like? It'd be nice if there was some opportunity to centralize that. So those are two of my points. I've been involved in the development of new graduate medical education. We need a whole team, and that team includes physicians that understand Alaska. And right now we have the Alaska Family Medicine Residency Program in Anchorage that is going to be graduating 8 family physicians a year and has populated the state with a lot of family physicians that were trained in state, which makes a big difference. There's also a new family medicine residency program being developed out in Matsu. There's the pediatric track, and there's also the internal medicine program in Soldotna. But we are number 50 out of 50 in slots for graduate medical education. And the best way to recruit physicians historically in Alaska has been through public health and military, but nationally, it's really having graduate medical education slots. So developing those slots within our state, I think, will help the workforce team altogether.
No, thank you. And I appreciate that insight. And Dr. Zink, I just wanted to ask you your thoughts on kind of that layering that we're talking about, building in the data, building in the innovation, because I know you've thought a lot about this.
Yeah, no, I appreciate that, Dr. Rabinowitz, and to Shane's comments. And I also want to highlight in there, Gloria has a survey. She's from UAA, and she's looking for your input on what this needs for workforce. So when I think of data, I think about the information that we have. How many licensed providers do we have? Where are they at? Where do they look? But there is also information layered on top of data. So I see like Mary Eckhart here, and I see people working all over the state. And we spend a lot of time thinking about how do we share data? What does that look like? And how oftentimes in community you can have a different sense of what's happening that's always reflected within the data and data space, particularly in the state, bigger than Texas, California, and Montana combined, working in such diverse areas. I will say that for our regional sessions, so there will be upcoming regional sessions, and in there we're talking a lot about how do we break out the data data per region so we have a better sense of what is that workforce, what are we paying for, what does that look like. So the Department of Health team is doing a lot of work thinking specifically about what data is needed there to look at the whole state and to be able to provide regional as well as the state perspective on what that looks like. But I see this rich conversation and dialogue in the chat box as information to layer on top of the data so that we make sure Alaskan projects work for Alaska. But go back to you, Dr. Rabinowitz.
Yeah, and we can switch to the next slide as we kind of start to synthesize what we found. And I'm going to kick this back to you, Dr. Zink, as we kind of wrap up some of these thoughts in the chat and then work towards our next session.
Great. Thank you so much. It's been fun to watching the chat box. And as you mentioned, time flies and we're wrapping it up. We ended these slides with just some targeted strengthening workforce projects to consider. Hopefully, this hour has been helpful for you to hear somewhat what's happening in Alaska, share with each other's ideas, connect, see some new ways. But thinking about kind of these 5 different buckets: targeted recruitment, retention, and incentives. And as Eliza and others have mentioned, you got to have jobs afterwards, as well as, that's a great incentive to stay, is if you have a job to do it. There's nothing better than being able to be paid for the work that you actually want to do. But how do you continue to upskill? How do you work in community? How do you make sure the working environment is one that provides sustainability and, just joy throughout your job? Expanding rural training. We've seen a lot of comments about build at home. There's nothing like, I'll never forget 2 community health workers out in the YK Delta, and just they're still working out there doing tremendous work, but they're from the village. They know that village and they provide amazing care every single day. They're part of my daily inspiration about like how you can train locally, keep locally, and do amazing work at home. Expanding residency rotations in rural. Barb Doty had brought that up specifically in talking about how we rank compared to other states, what that looks like, and how we can build upon that, as well as the rural internships. And it's great to see things that are already happening and talk about ways that we can support that moving forward. Facilitating modernization to support the workforce. So you'll see through the legislation right now, there is comments and conversations about things like streamlining licensing applications. There are all sorts of other things that were actually incentivized by CMS to be a part of there to kind of facilitate the workforce. And then workforce support and infrastructure and mentorship models. And this gets into the apprenticeship and mentorship. And, I think about communities like this are great mentorships and partnerships with each other. We get to learn from each other every day. And this is another way. So just really appreciate people showing up and being engaged and building our workforce here. Next slide, please. So those were some of my key takeaways. I guess I will echo what was previously said by another provider on this call, that I'm just really excited to see the excitement about what ways that we can really build the workforce. It's lonely being a provider without having the support and resources you need to care for patients. And it's been amazing to watch the state grow and develop, and really excited to see the impact of this. So those are some of my takeaways, and I'll hand it back over to you, Dr. Rabinowitz.
Perfect. And next slide. We really want to hear from all of you. So as we jump and look ahead to our next session for strengthening workforce, can you please tell us your #1 challenge you want us to tackle, and just put it in the chat box. And that's what we're going to focus on for our next session as we all come together. And we're still deciding what that looks like. We'll probably have some breakout sessions with that, but we're sorting on how to best use all this great stuff in the chat, stuff that people are working around the state, and really using that synergy to move forward. So throw stuff in the chat as much as you are willing to, so we can make this useful for all of you. And as people are doing that, if we can go to the next slide, I just want to remind people of the schedule. We have another initiative impact series happening later today. That's on healthy beginnings and really focusing on maternal and childcare and what that looks like and how we can broaden and strengthen that. So I encourage you, if that fits with your project or your vision, please attend that as well. Again, there's some crossover in these initial sessions, but any insights is appreciated. So please come if you think it applies to you. Great. And I'm seeing lots of great things popping into the chat right now. And I'm going to turn it back to Dr. Hedberg, or sorry, Commissioner Hedberg, and we can move to the next slide.
Thank you, Dr. Rabinowitz and Dr. Zink, for facilitating our first impact series on strengthening our workforce. For all of you that want to learn more information, you can take your cell phone, you can scan that QR code and learn more about how Alaska is implementing the Rural Health Transformation Program. Next slide. And just if you have questions, we have an inbox that is staffed by a team. It's doh.rhtp@alaska.gov. And just highlighting for you, as you can imagine, the department is overwhelmed enthusiastically by the response to this RHTP. This is good news. But we can't answer everyone's individual emails to our individual inboxes, which is why we have a general inbox and why we have the sign up for RHTP updates on our website. We continue to post updates on our website. So as soon as we update it, you'll be notified so you can be in the know with the latest information. Back to you, Dr. Zink and Dr. Rabinowitz.
Perfect. So we just wanted to thank everyone again for building this into your schedule today, taking the time to come and share. Echoing what Dr. Zink said, we are super excited. I think having spent our careers here, working in this system in Alaska and growing up myself in Alaska and accessing rural healthcare, I know what it means that the system we built over time is working, but we can do a lot better. So let's continue to innovate and make this Rural Health Transformation Fund create a new system that's going to work for everyone in Alaska. So thanks again for all of you showing up and taking your time, and we hope to see you at another session soon.
Bye, everyone. Take care.